I think we can go ahead and start the recording. I've got 1 o'clock on both of my phones.
We're recording.
Great, thank you. Hello, everyone. This is Brian Dowd from the Department of Community Health. I am the Deputy Executive Director over Policy, Operations, and Compliance here at the Department of Community Health. And this is our August Town Hall for the electronic visit verification. I want to remind folks that we have been doing these town halls since November of last year, at least twice a month. The first month we did 3, and we have done some extra ones along the way, but we have done at least 2 every month since November. And all of those town halls are still available on our website in their entirety. So every single recording is on there, and every single PowerPoint presentation. I always like to start with that because I don't want anyone to feel like they have to take notes or pictures or anything associated with these slides, because we're going to immediately make them available, including this recording, for your use. We start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? I know for those of you who have been attending multiple ones of these, you know that we're leaving these for the last couple of months open-ended. And we're trying to take what you guys are presenting to us as the most important topics to go over. So today we're going to go over and do some member updates. We're going to do some project updates. We're going to point you to EVV training. We're going to talk about a lot of common issues or questions that you guys have presented either through the call center or through our DCH EVV mailbox, or that you've directly presented to me or other staff members at DCH or the Department of Behavioral Health and Developmental Disabilities, or anywhere else that have come to our attention. We're going to give you the upcoming town hall information and the upcoming third-party EVV vendor end update that we do every single presentation. And then we're going to give you a little bit, hopefully we'll have enough Q&A time to go over whatever you guys have as questions. So we're going to start off with member updates. One of the things that we heard in previous town halls a couple of months ago, and we're really trying to stick to it. Hold on, sorry, I messed that up. There you go. That we're really trying to stick to is that self-directed members let us know, hey, we really need every single presentation to have us represented in some form or fashion. So we took the approach from the beginning that all information was available to everyone, to members, to providers, to advocates, to key stakeholders, case managers, whomever. We wanted to have all information open and available fully transparently to everyone. But we did recognize a few months ago that it might be helpful to break out for self-directed members just at the beginning, just to target folks and let you know what's going on. So you, in your compliance with EVV, moving to compliance with EVV, are going to be working with the fiscal intermediary that you have chosen. Each of them have different timelines. Each of them have different methodologies for becoming compliant with EVV. Self-directed members are welcome to stay for the remainder of this presentation, but it's primarily going to be Q&As for traditional providers. I would encourage you to stay in contact, stay up with the websites of your FIs. I know that Acumen is fully moving to their DCI system. I have heard from many participant-directed folks about that transition, and we've been able to get you in touch with some of the resources at Acumen about your concerns. There's been some recent questions and concerns related to both Continuum and public partnership as well. We at the Department of Community Health are always open to those questions, and we'll provide our email address at the end, but it is available on our EVV website and all previous presentations as well. I've probably done one-on-one meetings with over 100 participant-directed family members over the last month and a half. It has been a pleasure to speak to the family members and the members that have called to discuss EVV with me. So if there is an instance where you are requesting a one-on-one call, I will be more than happy to accommodate that. Let me say this, I cannot drop what I am doing and call you immediately. Several of you guys have sent me emails that have been like, here's my number, can you please call me now? That's very difficult for me. I may be doing a presentation like this. I may be on a site visit at a facility. I may be talking to a provider like CHOA or have a half-an-hour meeting set up with a different entity or different provider. But what I will do is I will present you with some dates and times that we can connect. And I have not had a problem with anybody who has approached me setting up some scheduled time so that we'll be able to talk. So in addition to that, we want to give you your contacts if you are self-directed. These are the email contacts and telephone numbers directly to your points of contact at your chosen FI. So Acumen Continuum and Public Partnership, you have email contacts that you can get in touch with. And you have different town hall recordings that will also link you to information. Again, this will be available on your website, and it's actually in last month's website presentation as well. So you could just go to last month's town hall and have this information. No need to furiously write down email address and phone numbers because we do have this publicly available to you guys. All right, another big question that has come up since the last couple of months when we introduced a new service really for members was Georgia Lifeline. As you may or may not be aware, we initially, when we had developed the electronic visit verification, we had provided a few different modalities for completing EVV. The most popular, most efficient, the easiest to use is the application on a smartphone. So we encourage folks to use that whenever possible. Excuse me, for those who don't have a smartphone, whose workers don't have a smartphone, we also provide an exception option whereby members can use a hard line in the member's phone. So if you have an old school telephone line in your house that you pick up, then you can submit the attestation, the request to use that hard line phone. If your workers do not have a smartphone, or if there is a religious reason why a smartphone can't be in your house, or a medical reason why a smartphone can't be in the house, then we will be happy to review and approve those requests for telephonic use. Initially, we had also planned on doing fixed devices that we would deploy to members. But since we contracted EVV in the current day, there's been quite a bit of change in best practices in EVV nationwide. And the fixed devices and smart and fob use are not industry best practices anymore, and really not a preferred method of using EVV. So as a solution, what we can offer is Georgia Lifeline. Medicaid members who are eligible for Medicaid are eligible for a free phone and free services on that phone, including unlimited text and talk. It is also provided on Georgia Lifeline data for internet use. So the member could get a free phone, keep that free phone at home, and use that free phone when their workers come in to clock in and clock out on the application. The good news that we have learned from the Georgia Lifeline people, and this is really great news, EVV time, so data on EVV will not count towards the Lifeline phones. So even if you use up all of your data doing other things, scheduling medical appointments, whatever else you're using the free Lifeline phone for, EVV will continue to work on your application because none of the minutes associated with EVV count towards smartphone data time. So there's really no reason why you couldn't use a Georgia Lifeline phone if your workers don't have a phone. You could get one of these, and then they would be able to just simply get on the app, use their unique password, and log in order to clock in and clock out. There are additional federally sponsored smartphone options out there besides the Georgia Lifeline phone. We have not had conversations with those folks to ensure that they are compatible and EVV compliant. And our understanding from members is not all free smartphones that are provided support the mobile caregiver app that is needed to do EVV. But we can tell you that the Georgia Lifeline phone is able to support the application. And again, the data minutes are free. So let's give you some project updates. Where are we? We are past the July 23rd mandatory requirement for providers to register. And I just got a listing today of all of the providers that have a specialty code of personal support services and CLS services that have not registered as of yet. And I want to take a moment to let you know that we will be placing these providers on prepayment review until which time they register with EVV. Now, one of the things that I've noticed from looking over this form is that some agencies have registered one of their IDs, but they have not registered all of their associated CLS and PSS IDs. You don't have to register IDs that are associated with ADH or CRA or any other service. But if you have a PSS number that is for 5 different offices, all 5 of those offices have unique Medicaid IDs, and they all must be registered. We've been saying this since our first November town hall meeting. So it's really, really important that you go back, because what's going to happen is we're going to have, if you've registered 2 of your 8 IDs, you're going to be able to get paid on the 2, but on the 6 that you haven't registered, those are going to hang up because they're not registered with EVV. So it's really important that any PSS and CLS IDs are registered. You are past the deadline now for that happening. It was July 23rd. As of August 31st, 2021, the end of this month, you must go in and successfully submit a claim through each ID. Just one claim. You don't have to do multiple claims. You don't have to do a claim by member or by provider, but by ID. And again, you may have multiple IDs that do PSS. So every one of your IDs, you need to make sure that you are able to submit a claim through TELUS. So you got to schedule at least one member, clock in, clock out, make sure everything matches up, and send it across for payment. You have until the end of the month for that to happen, August 31st. Those provider numbers that don't do so will be placed on prepayment review. October 1st, 2021, we will be going live with our claims edit in GAMUS. And all PSS and CLS services will be required to be run through the EVV system, whether it's your third party that is connecting to the NetSmart system, or whether it's directly with the NetSmart system. You will no longer be able to, as of October 1st, 2 months from now, to go in and submit claims into GAMUS. The only exception will be if you can produce an active open ticket where it is NetSmart or GAMUS's issue that is preventing you from submitting claims. There has to be an active open ticket that will show that you're doing everything you're supposed to do and it's still not working. In those cases, we will be able to administratively override any claims that have gone through. So if you have not registered, you need to register now. Once you register, you need to go to our EVV mailbox, which is right here, evv.medicaid@dch.ga.gov, and just let us know that you have registered so we can make sure we're taking you off the prepayment review list. Last week, I probably had 20 to 30 providers write me just to confirm, hey, I'm sorry I missed the deadline, but I've already gotten myself registered, so could you please take me off prepayment review? If you have registered, you just need to continue to follow the steps in the checklist that we have available online. So we have a toolkit and a checklist that's available online on our website, and we'll point you to that in just a minute. And it points you to completing the trainings, ensuring that your aides have downloaded and successfully logged onto their mobile apps. It gets them to start completing visits, so it gets them to clocking in and clocking out. And you probably want to go ahead and submit a claim. If you're all the way through that process, go ahead and have one of your workers submit a claim through so that we aren't, looking at prepayment review at the end of the month. I've also gotten a lot of questions about case management. A lot of case management providers have contacted me and said, hey, we're ready to register and get that look into EVV that you've been talking about. So I just want to say I really appreciate the enthusiasm of those case management providers. And I also really appreciate how much they're up on the EVV and paying attention and monitoring the website. So right now, any kind of registration is optional. You don't have to go in and register right now. And if you do go in and register, all the information is not going to be available for you. So you're going to see a lot of blank data at the moment. We expect full case management functionality to be available September 16th. And we will be doing training before that time just to show you and providing guides and checklists, just to show you what the functionality is that will be available to you in your case management functions. All right, let's talk a little bit about EVV training. So if you are a provider using the NetSmart system, you need to be doing those things that are on the left over here. You should register and complete trainings for the administrative console, if you're a provider, mobile application, and claims console at a minimum. So caregivers or aides who don't do administrative functions only need to register and complete the mobile application training, because your aides aren't going to be doing the administrative functions of EVV, and they're not going to be submitting claims, but they do need to know how to use that mobile application. Providers using a third-party EVV system, you've gone out there and gotten one of those third-party providers, and you're going to need to have that provider will be talking to our system. You need to still register and complete the claims console training under EVV. But caregivers and aides don't need to complete the NetSmart mobile application training, because they're going to be using your third party's mobile application to do clock in and clock out. So we would expect that third party to have their own set of training suite, including how to use that mobile clock in and clock out. I get a lot of questions about EVV and where training is available on EVV. This is the website. And again, this is available on the our EVV website at DCH and all of the PowerPoint trainings. So you can pull up this address immediately. But this information is there. As you will see, the three webinars we just talked about are right here: administrative, claims, and mobile application, and they're there for you to use. There's also extra topic webinars that you can look in as well. There's weekly live webinars that are available, and there's pre-recording webinars that are available at your convenience. If you have a question that you don't feel like is covered by the Townhalls, any of the trainings, any of the written resources that are out there for EVV, so any of the recordings or paper or frequently asked questions, NetSmart provides a weekly live Q&A session that you can register for. And we have heard these are very sparsely attended. So if you attend this training, you are very likely to get one-on-one instruction to answer your questions and concerns. These are weekly, and they are available to you for anything that is not covered in any of the rest of the trainings. Once you have registered for the NetSmart solution, so you're a provider out there, you've got your access, there's even more user guides and short refresher videos. You can print these as well to give to employees, or you can download them just to have for your reference so you don't even have to go into the administrative training. If you go to the dashboard in your application, the administrative function, you will see this little training marker on the left from the menu. And this gives a lot of really great short training how-to videos. They're all between 15, 12 minutes. Some are shorter than that. They're really good for people like me who have attention deficit problems, who can really focus on what the individual topics are and not attend a big, long training where someone's talking like I'm doing now for a good 21 minutes. So let's go over some common issues and questions. We've been getting a lot of questions about documentation or signatures on timesheets. It's important to note we haven't changed any of the documentation requirements for the waivers or for the GAP program. If something is documented on EVV, like tasks that you were previously documenting on paper, you do not have to re-document that. If an auditor comes in, whether it be the federal auditors, for like the payment error rate measurement audit, or whether it be, agency auditors or Office of Inspector General, they will have access to the EVV system and they will be able to see the tasks that you have been performing during the day. But if it's not an EVV, like an RN signature, then you're going to have to document that information separately and physically sign it. And that may mean that you have to print out a daily or weekly schedule or timesheet or task list. Another big question that we get consistently is, well, what about retroactive billing? What about Medicaid pending clients? So that hasn't changed either. So if you have a current PA for that member, you can schedule visits on the application. But EVV doesn't find out that you have an active member for services until there's an active PA. So if you have a member that is out there who is pending Medicaid eligibility with the Division of Family and Children's Services, that defects worker hasn't approved them yet, and they're what we call a lot of times PMAO. So they have to go through the Medicaid eligibility process. You need to document those initial visits on paper, and you will be able to go in and administratively put them in. We should receive that member once there is an active PA for them to receive services in the waiver or through the GAP program. If you have missing members or if you have missing prior authorizations, and I get very few questions about missing prior authorizations at this point, but I do still get questions about missing members. You need to call the call center, and we'll give you that information here. They will look to see if they can't match you up to the members. A lot of times when we're getting this, your members are under a different ID. So if you've only added an ID for one of your offices and that member's PA is tied to one of the other 8 offices you have, you're not going to see that member until you register that additional office, and they're going to be on your list of members for that office. So a lot of times that's what we're seeing happening. But if that is not the case and it is some sort of system or interface issue between GAMUS and EVV, we will make sure we open a ticket and respond back to you as soon as possible. You do need to register even if you're using a third-party vendor. This is a question that's come up over and over and over again, which is, hey, well, I'm using a third party, so I don't have to register. Yep, you still need to register, and you still need to do that claims console training so you are aware of how to once that information passes from your third party to us, that you can pass it through so you can get your claims paid. We do have provider checklists that are available. both in phase 1 and phase 2. And again, these links will be available on our website, so you don't have to write anything down. These were also available in last month's training. So this is the call center number that I just promised you we would give you, 1-833-701-0012. This is a number that you're going to want to call if you have a member with an active prior authorization for services, CLS or PSS, and they are not showing up in the EVV system. We also provide you with an email contact and a website for chat as well. So what's next upcoming to our webinars? We are going to do an open topics today and tomorrow from 6 to 7. And then we're going to do open topics in September as well. We don't have the dates quite yet set, but we have discussed them. We're likely to do 2 at the beginning of the month and then 1 at the end of the month, right before we go live with the claims edit, because that's when a lot of questions seem to pop up right at the deadline. We have noticed that we get a whole lot of interaction right before a deadline. I probably had 100 people register the day of the deadline or the day after the deadline. 100 IDs got registered on that day. So nice to see that there's some procrastinators out there like me, but it does have to be done by the deadline. So we are definitely looking to have a late September meeting as well. We do not anticipate on pushing back the claims edit at this point, and we are quite confident that we will move forward with the claims edit as of October 1st. We have zero plans to delay any further. This is our alternate EVV vendor update that we present every month. As you will see, we continue to have a large movement to the right. We have a lot more providers that are fully in production here. So we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 at this point. We have a very long list that is in pilot at this point. And that's a lot that's in pilot. And some people have written me, I probably got 2 or 3 people writing me saying, what does in pilot mean? In pilot means that they're testing, that it means just what it says, it's in pilot. So they're testing with different claims, they're testing with different scenarios to make sure that everything is covered before they say, okay, I think we're good, we don't need to do any more testing. That's what in pilot means. They're in production, but they're not 100% ready to give up and say, we don't need to do any more testing. And then there's folks who have just started testing and they have some testing in progress. And then we've got a larger group that is in development, meaning they've contracted with us, but they're now starting to get their connections going between the two. We do have some providers that are contracting with us. They're still working through some contracting issues, and we're still moving forward with those. And we've had some recent contact with a couple of providers as well. The last thing I want to point out here is these 1, 2, 3, 4, 5, 6 providers at the bottom who have declined integration. We are assuming that's because they don't have any providers who use their system in this state for PSS or CLS. But if you are using one of these providers as your third party and you don't plan on using the NetSmart system, you need to be in conversations with them, because October 1st, if they try and submit claims, they're not going to go through the Gamma system, just like if you're not using the NetSmart system, they're not going to go through the Gamma system. Okay, we're at our stopping point. I want to remind people that you should really first go to the call center with your issues and concerns, but that we are also available at the EVV, our EVV mailbox, which was provided in this presentation as well. But we're going to keep the call center email up and the call center number up, because we at DCH do monitor the call center as well. So we know what questions you're sending in and asking about. Okay, I'm going to pause here and open up the Q&A and check out what we got in there. And see how many of these we can answer in our remaining time. So the first question I got is, I'm going to actually combine the first three questions because they kind of go together. And they are, cannot find client in EVV. If some of our clients are not populating in EVV, what do we do? And they're saying that they have an active PA. If you have members with an active PA for service in GAMUS and it is not showing up in EVV, call this number that is on the screen or email this email address that is on the screen and give them the information, including that active PA number, so that we can research and see what's going on. How do you use the landline? There absolutely is training on the landline. Your first step is to go to our EVV website and fill out the request for IVR usage and send that to us. Once that has been approved, we notify NetSmart that you have an approved landline usage, and they reach out to you with the information associated with doing telephonic entry. You do, and Joe has talked about this in previous emails from NetSmart, you do lose a lot of functionality by using that landline, and there's a little bit more administrative work you have to do. I would encourage you to go back and review those previous town halls from 2 months ago, and it will give you a lot of the plus and minuses. But there may be instances where your workers don't have a phone, or there's a religious or physical reason why they can't use a phone. And in those instances, please just use the IVR. We'll review it and approve it, and we'll get you the information for training at that point. Any updates on rounding rules? Yes, we are. And thank you for paying attention to the previous town halls. And we are continuing to go through and update the rounding rules. We just got through the change order process with TELUS. So they are working on that now. We should have something out to you here in this month about the implemented rounding rules. What should we do if we are not receiving payment for claims? Okay, so despite opening tickets and reporting to the EVV conduit, then you should let me know or let the EVV mailbox know that you can continue to submit claims through GAMUS. So if you need to submit claims through GAMUS, you can continue to do that up until October 1st. All right, I'm going to pause for just a second because that's our last question. I also need to breathe. That was a lot of talking at once. All righty, seeing no more questions, I want to thank everybody for their time and presentation today. And let you know that I really, really, really appreciate everything that you're doing and your ability to keep up to date with everything that's going on with TELUS. Thank you, and I hope you have a wonderful day.